In order to establish or achieve a beautiful breast, certain criteria must be followed. Most people consider that a beautiful breast should include a gentle slope from the upper chest to the peak of the breast at the nipple, and then a gentle arc from the nipple to the base of the breast. The breast should also be rounded at the side and, of course, have a natural cleavage. The nipple should be located central to the breast mound. Breast enlargement, technically known as augmentation mammoplasty, is a surgical procedure to enhance the size and shape of a woman's breast in order to achieve an improvement in body contour of a woman who, for personal reasons, feel her breast size is too small, or to correct a reduction in breast volume after pregnancy or weight loss. Breast augmentation can also be considered in order to balance a difference in breast size or as a reconstructive technique following breast surgery. The best candidates for breast augmentation are women who are looking for an improvement and not perfection in the way they look. A breast implant is made from an outer layer of silicone but may be filled with silicone gel or salt water. Some implants are round and others are teardrop shaped. Either can give excellent results. The manufacturer's life expectancy of breast implants is in the region of 10 to 15 years, although it should be noted that implants can stay in place without problems for a much longer time. Today, an enormous choice of shape and size exists, which allows surgeons to tailor-make the procedure to satisfy individual patient needs. The most suitable shape and size of implant for each patient will be discussed and decided upon at their individual consultation. Whatever the filling of the implant, the outer layer is made of silicone. Silicone is a naturally occurring element and is manufactured into many items including cosmetics, foods and medical implants. Many studies have looked into whether silicone breast implants cause certain diseases. As a result of these studies, which include the Independent Review Group of the United Kingdom, the Institute of Medicine commissioned by the US Congress, and the National Scientific Panel appointed by the US courts, we can say that there is no indication of increased risk of developing autoimmune or so-called human adjuvant disease with breast augmentation. And it has also been proven that breast augmentation and breastfeeding are safe. They do, however, stress the importance of providing clear and comprehensive information so that patients can make informed decisions. The method of inserting and positioning your breast implant will depend on your anatomy and your surgeon's recommendation. However, to better understand how breast augmentation is performed, some basic understanding of the breast anatomy is required. The breast is made up of the skin, the nipple, and the coloured piece of skin around the nipple known as the areola. Deep to this, milk ducts and milk glands, necessary for breastfeeding, plus fatty tissue, exist. Deep to the breast itself lie the major muscles of the chest wall called the pectoral muscles, and deeper still lays the chest wall made up of ribs and its associated muscles and tendons. It is important to know that the implant is always placed behind the breast and not inside it. Therefore, breastfeeding and examination for breast lumps and mammography are all possible. The incision can be made either in the crease where the breast meets the chest, around the dark skin surrounding the nipple, the areola, in the armpit, or sometimes in the tummy button. Working through this incision, the surgeon will lift your breast tissue and skin to create a pocket, either directly behind the breast tissue itself or underneath your chest wall muscle. If the implants are placed behind the muscle, the inner and lower surface of the muscle are released to help create a good cleavage and prevent the implant being displaced upwards or outwards. The surgery usually takes between 1 and 2 hours to complete. Stitches are used to close the incisions which will be taped for greater support. The level of post-operative discomfort after this procedure, to a certain extent, relies on the surgeon's delicacy in handling the tissues. If the surgeon handles the tissues carefully and makes sure that there is no bruising or bleeding, the patient will experience less pain than rough or aggressive handling of the tissues. Post-operative discomfort is usually mild to moderate and is well tolerated with simple pain relief like paracetamol or codeine. Stitches will dissolve and the wound will be reviewed at 7 to 10 days post-operatively. Vitamin E cream can be used to improve your scar quality starting 3 weeks after surgery. Patients return to work on average between 7 and 10 days post-operatively. Most women have some degree of difference, otherwise known as asymmetry, between the breasts. Breast augmentation will usually reduce this difference, but to a degree, asymmetry is to be expected and no one has identical breasts. A breast that has an underlying implant will not necessarily feel like a normal breast, and some women may be aware of the implant as a foreign body within the breast. There is usually a difference in skin and nipple sensation following breast augmentation. The size and shape of the breast following breast augmentation will alter and settle with time. It is not always possible to create a cleavage with breast augmentation. The weight of the implant may influence the age-related changes that normally take place in the breasts. The presence of breast implants does not interfere with mammography or other imaging techniques for breast cancer, such as ultrasound or MRI. The breast augmentation operation will leave scars under the breast or around the nipple or in the armpit. The scars will settle over 12 or more months, and the appearance of scars does vary between different people. Usually the scars settle well and end up as fine white lines, but they may always be noticeable. Some people have an inborn tendency for scars to stretch, and sometimes scars can stay thick and red for some time. Complications of breast augmentation are pleasingly rare. It is important to remember that it is not possible to guarantee an exact cup size following augmentation, as bra manufacturers vary in their criteria. As mentioned earlier, any difference between the breasts or asymmetry will persist, although the differences may be much less noticeable than previously. It is also important to remember that you will get used to your new breast size relatively quickly, and it is always important to think perhaps slightly larger rather than slightly smaller. Capsule formation, or hardening of the implant, occurs in perhaps 5% of patients at 5 years. General complications include things such as infection or bleeding. Bleeding is perhaps the most common and may require a return to theatre in order to stop the bleeding and remove the clots. Infection following breast augmentation is also rare, but if it occurs in the region of the implant, it may require the implant being removed and replaced after a period of some 3 to 4 months. The suitability for this type of treatment, as with any treatment, will be assessed by your surgeon at the consultation. But it is based on several factors, such as the quality and elasticity of your skin and the general condition of yourself, including your past medical history. The specifics of any procedure are best discussed with your surgeon at your consultation for a complete and full understanding of what the procedure entails. I also recommend that any patient who is seeking this procedure to have the procedure performed at a registered accredited hospital where the operation is performed under sterile conditions, and that's why I recommend Nuffield Hospital Brighton, which meets this criteria.